Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Sridhar Rajamani. He's a pulmonary physician and he wrote the Kevin MD article, How Can We Redefine Locum Tenens? Sridhar, welcome to the show.
Thank you, Dr. Poe.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Like you said, I'm a pulmonary critical care physician. I finished my fellowship almost 20 years ago in New York, and my wife wanted to go to someplace warm, so we went to Southwest Arizona and started a private practice supported by the hospital. That was not my passion, though. My passion was always critical care, ICU, and wanted to start intensive services. And this was the infancy of all this closed ICU, leapfrog, and all of that stuff. Luckily for me, the hospital was very supportive. A few years into my practice, they said, why don't you guys get together and put together a practice? And we did, a 24/7 in-house intensivist practice. We grew from a 16-bed ICU to a 42-bed ICU. The hospital grew, the ICU grew, services grew, and we had phenomenal outcomes. We ran the program for about 15 years until earlier this year, when we decided we were all getting older and it's getting a little difficult to run practices and do all of these things. And the hospital was gracious enough to take over the practice and run the practice as they're doing right now. I have to be honest, I couldn't have run the whole program, or we couldn't have run the whole program if not for locum support. So over the last maybe 10 years or so, I got to know a lot of different locum companies, and we brought in a lot of different locum physicians, and we learned from them. And when the hospital took over our practice, many of these locum physicians got absorbed as full-time either employees or contractors. So that's pretty much my journey. And now I do a lot more locums than I used to, and I'm having fun with it.
Let's transition now to your Kevin MD article, How Can We Redefine Locum Tenens? Now, for those who haven't read the article, can you just walk my audience through it and maybe share the story of why you decided to write it?
Last year, I was invited to attend a retreat at locumtenens.com's customer advisory board. I had used physicians from the locumtenens.com company to staff our practice. And I also worked with them on the physician side for a couple of assignments here and there. So I got to know them, they got to know me. I said, you have experience on both sides of the aisle. Why don't you come and give us your input? So I went there and I got to meet a lot of similar-minded physicians and some administrators as well. And as I got to talking and I gave my perspective as the client and the physician, they said, why don't you write an article, see how this goes? Because locum tenens, as you know, Dr. Poe, has not always been received in a positive way. And there have been different names called. So I said, to put some positive, for lack of a better word, spin on the whole locums opportunities, they said, why don't you put together an article? And I did that. And that's what happened eventually with the help of locumtenens.com. We wrote this article. The goal for this article is not to promote locums or not to promote. That's not it. It's basically my observations, my personal experiences, and what I think is the future for healthcare staffing. I'm a critical care physician. There's maybe 5,000 of us who are board certified, and there's not a whole lot coming out every year. So it is a difficult specialty to recruit. Hospitalist is a difficult specialty to recruit. And we cannot have the same mindset we had 20 years ago, 30 years ago in terms of recruitment. This is another tool in the toolbox for recruitment. And as opposed to common thinking, it is not that expensive. It's either on par with regular recruitments or sometimes even comes out cheaper. So that is what I wanted to focus is use this. This is a tool you can have in your arsenal of how you staff and all of that stuff. We have to get creative. And as you see, the article pretty much highlights all of those points. And what are the good things that can come from locums? It's not for everyone. It's for a lot of people. So that's pretty much how it is.
Now, what would you say are some of the biggest misconceptions about locum tenens?
Bad quality. These guys have the locum guys come, they punch in, punch out. They don't care about quality. That's a huge misconception. And I'm going to talk about it in just 1 second, why I think it's a misconception. 2, it's very expensive. And that again is wrong. I have recruited locums. I have used locums in my own private practice, and it is not any more expensive than a regular full-time physician. Now, coming back to the quality piece, when you bring in a locum physician, you're credentialing them exactly like you do anybody else. But the advantage with these guys is they come from different experiences, backgrounds, and they bring that experience with them. They've seen different protocols, different guidelines, and they bring all of that to your practice, and they support your practice doing that. If anything, it elevates your care. It gives you more diverse clinical experience, if you may. So in my personal experience, in the way we have practiced in our intensivist group, they have actually improved, and we have learned a lot. We have brought in new procedures, new services because of these guys. So quality that's a big, big misconception, and that is not true. Financial aspect. Yes, if you look at the initial dollars and cents, it looks like it may be expensive. But in the long run, if you have a steady crew of locum people coming to you, working with you, your overheads are pretty much the same. You pay them an hourly or a daily per diem or whatever it is. But you're not worried about your disability, your life insurance, your malpractice. All of that stuff is all baked into the equation here. When you run the balance sheet at the end of the year, it's almost similar to a full-time employee. The one advantage you have with locums is if you don't think it's a right fit, if you don't think that's the right person for your organization's culture, you can always give a 30-day notice and you walk out. That person walks out, it's a clean split, and everybody's happy. But it's very hard to do when you have a full-time employed physician or a provider. Then you have to worry about tail insurance. You have to worry about how do you separate or sever yourself from a job contract, employment contract. It can get a little tricky sometimes. So there are advantages to this whole locum opportunity.
Now, in general, can you tell me about the pool of physicians that you could draw from locum tenens? In other words, what kind of doctors normally apply to become locum tenens physicians?
Initially, it used to be hospital-based practices, hospitalists, anesthesiologists, emergency room physicians, ICU doctors. Now, when I go visit other places, I see neurologists, cardiologists. I even know a cardiac surgeon who did locum work. Infectious disease has become because these are specialties that are now not easily available for recruitment. The other thing that you see is most of these locum opportunities used to be in very rural, remote areas. That is the past. Now even big cities, big suburban areas are requiring locums just because there is not enough people coming out of fellowship or training or residency training these times. So even though hospitalists and hospital-based practices are still the largest number of locum physicians, the other physicians, outpatient care, for example, offices, pulmonologists, I'm a pulmonologist. I hear people more and more these days calling me saying, would you like to cover 8 hours office work because we don't have a pulmonologist. And our outpatient, we have 250,000 people in this town, and there's not a pulmonologist in town. And we'd like to start an office practice, take care of our asthma, COPD, decrease readmissions. So there is opportunity for that as well.
Now, if I'm a medical institution looking for a locums physician, as you know, there are so many different companies that are available out there. On the other side, as a physician myself, I get emails all the time from different locums companies. Now, what separates one company from another?
There used to be maybe 5 large companies in the past, but now you have probably 500 of those. Even physicians who are very entrepreneurial have started their own locum companies. At the end of the day, it doesn't matter who anybody works with, it's the service you get from them. And that personalized service, physicians want to have less hassle. That's the reason some physicians choose locum opportunities, is to have less hassle. Somebody takes care of your logistics, and you're in a difficult situation, you call them, they figure out what's going on, and they help you with maybe travel, maybe other things. And they also listen to what you want. That's important in a company. When a company picks up and says, hey, doc, I have a position here, do you want to go? Instead, if they call and say, hey, I'm available, if you're available to do locums, I'd like to hear more about your story and see what you want to offer. And then let's see if I can find a good fit for you.
Now, if I'm a physician and I'm thinking of transitioning into locums, what are some of the things that I should look for when evaluating a potential locums opportunity?
Do you like traveling? Would you be comfortable staying away from family for periods of time? Would you be willing to take care of your own retirement planning, your own taxes? The taxes get a little complicated in terms of when you do work in 3 or 4 different states. Each one, you have to file taxes in different states. It's a little more complex. Would you be comfortable buying your own healthcare insurance? Do you like flexibility? Do you want to work holidays? So there are a lot of different spokes to this wheel. And at the end of the day, what is it that you want, and where is your comfort zone? One thing I have to say that I have seen across the board when I talk to other locum physicians, and I have had this experience too, is when you come out of your comfort zone, you are happy in an XYZ hospital or in a practice, and good or bad, you kind of got used to that practice. Now you go from that practice and you're dislocated into a different place where the culture is different, the people are different, sometimes the practices are different. You're completely out of your element and your comfort zone. Are you going to be okay making the transition? You will be comfortable eventually, but for the first few days, a few weeks, maybe you won't be. Is that something you're comfortable with? Is that something you are going to be able to work through? So those are things I would suggest looking at.
We're talking to Sridhar Rajamani. He's a pulmonary physician, and he wrote the Kevin MD article, How Can We Redefine Locum Tenens? Sridhar, are there any red flags that physicians should look out for when it comes to evaluating the various locum tenens companies? You mentioned customer service, of course, that's important, but what are some of the other red flags that should serve as warning signs?
Some companies are very pushy. They would call you at all hours of day and night. And I'm sure you've seen that. You probably get those calls too. And I would caution against those. The reason is each company is structured differently. And some of these companies have a bonus built into it for a client advisor or whatever, or some of them are salaried. And it's very easy, for physicians to pick up the red flags and saying, are they being too pushy? Are they just trying to get me a job so that they can get to a certain quota or a certain bottom line? Or are they actually truly trying to help me out here? And sometimes you have to be careful if they're misrepresenting some opportunities. I always ask when people call me, can I speak with somebody on the other side, that works at that place? If they say, I have an ICU job there, say, can I speak with the medical director there? Or can I speak to some other physicians that are working there? Or maybe even the ICU manager, just to get an idea of what this is all about. You may want to do that in the beginning with any company. But once you know who your client advisor is, once you have a rapport with a certain locum company, you know that they're truly representing you, then you get a little more comfortable working with them. And you may kind of say, you're giving me this, I'll take it, no problem. But in the initial stages, I suggest not just talking to your client rep, but talking to the clinical people on the other side. Maybe there's, you have to walk on eggshells. Maybe there's a landmine that you don't know. And that is the reason for actually bringing in locums. There is a practice. The hospital may be fighting a practice for political reasons, and they want to fill that position. You may be walking into a very difficult situation. So unless you make that phone call, you wouldn't know what to expect. So initially, I suggest having that phone call with clinical people on the ground, and then deciding what you want to do.
Now we're speaking in the week before Thanksgiving, and as you know, the pandemic is flaring in pretty much the whole country. How has COVID-19 affected the locum tenens industry?
I don't think the locums, the pandemic could have been countered or at least met with the way it was met without locums involvement. And there is absolutely no way that could have happened. People came out of retirement when locums made those calls and said, can you help out? And they came out of retirement to help out. What COVID has done is unmasked the friability in our healthcare delivery system. And I'm not talking Washington, I'm not talking state laws or anything. I'm just talking every hospital, every practice, how unprepared we are in staffing and in being dynamic about our staffing, through the ebb and flow. But it should come as no surprise to us how resourceful the medical field is. The front lines have been pretty much taken over by the locums. I read in a survey, about 80% of physicians that went to New York during the peak of pandemic were actually coming from another state. Their state of residence was not New York, and about 60% of them didn't even have New York licenses. Without locums, I don't think the COVID problem could have been taken care of, and it still continues to be an issue. Now that brings me to the other issue, what COVID has done, particularly to the locums industry. Places like New Jersey, Texas, California, they're all difficult states to license, not because they don't want to bring physicians, it's just the bureaucracy, the paperwork, the red tape that is involved. But they've all gotten they quickly changed their bureaucracy, they quickly changed their red tape and opened up for temporary licenses to face the pandemic. I hope this leads to a much more, open conversation about, working across state lines and getting licensed without too much of a hassle. And I think that there is conversation happening at all levels, and I'm hoping and I'm optimistic that happens. Telehealth, COVID has opened up telehealth. And it should be, a wider adoption should be encouraged with telehealth. I know people still don't go see their primary physicians, don't go see their oncologists or whatever. But telehealth has opened up, and I hope it becomes permanent and with a little more wide scope. So that's what I think locums and COVID has done.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
You don't have to go with the traditional job options that were in the market many, many years ago. In my case, 20 years ago when I graduated, there were only 3 different options. Open your own store, join a private practice, have a couple of years of sweat equity, and then buy into a partnership, or join a hospital. Now you have another option. You can have a real life interview, real life test drive, if you may. After you graduate, you could do a couple of years of locum, see what you like, see which place you like, and decide if you where you want to go in a permanent job. That is an option. And I would also say this to the same thing to the administrators. This is another tool in your toolbox, like I've said, and it should not be trivialized, and it should be looked at more positively. You get to test a physician, you get to see a physician in action. When I say physician, it's clinician, then these days nurse practitioners, PAs, all of them do that. So it's providers, clinicians. You can see how a physician or a clinician is in their element. And then, instead of a one-day interview, come in, have a real estate tour and walk. This is a real life interview, you can do that. And you could have a more happy provider in your practice. And the bottom line is, if you enjoy flexibility, if you like career independence, making your own schedule, this could be a solid career choice, or even a part-time choice if you want to augment your current income. Hospitalists, intensivists, they all have gone to the 7 days, 7 on, 7 off kind of deal. You have some time on your hands, and you could do some locum to augment your income, pay off those big loans you come up with, or pay off that house, mortgage in the house, those kind of things. So another option to look at. That's my take-home message.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much, Dr. Paul.